Hello,
Hi.
my name is Michael. I'm going to be your student nurse practitioner today. And your name is Tatiana Wiseman.
Correct.
Can I address you by Tatiana?
Yes.
All right, thank you for that. Today I'm going to be performing the head, ears, eyes, nose, and throat assessment on you. Is that okay?
Yes.
All right, I'm going to wash my hands and then we can begin.
Okay.
All right, first I'm going to start off by inspecting your face, the skin in your face.
Okay.
Again, I'm checking for any lesions or scarring, any excess moisture, which could be a sign of a thyroid issue, any temperature, which is a sign of an infection. And everything looks well. Thank you for that. Next, we're going to go into, I'm going to check your temporal lobes. And those look within normal limits. Next, I'm going to check your preocular, I'm going to check your lymph nodes.
Okay.
And I'm going to go check the sides of your ears and your back of your head and into your neck. Is that okay?
Yes.
All right. First, we're going to be checking the preocular. And what I'm looking for is tenderness and some firmness, which I don't feel. Is that tender at all?
No.
All right. Now, next I'm going to check the post-ocular
Mm-hmm.
lymph nodes. Then I'm going to check occipital. Is there any tenderness so far or any discomfort?
No.
Next, I'm going to check the tonsillar lymph nodes. Then the mandibular lymph nodes. Then the submental lymph node. Any tenderness at all so far?
No.
And I don't feel any firmness at all. Next, I'm going to check the pre-cervical or anterior cervical lymph node, I should say. Then the posterior cervical lymph node. Then the clavicular lymph node. And again, it's right in here. Now, if that was firm, which would indicate Bowchow's nodule, and that's a sign of either a gastric or lung malignancy. So, here we go. Next, I'm going to check your cranial nerve 5.
Okay.
And we're trying to rule out Bell's palsy or symptoms of a stroke. So, actually, I'm going to check the master muscle right here, and I need you to clench your jaw, please. And that looks within normal limits. Any tenderness or pain to that area?
Mm-mm.
All right, thank you for that. Now I'm going to check for sensory. Can you feel that?
Yes.
Is there any pain at all?
No.
All right. Check her chin, her cheeks, and her nose. No pain at all?
No.
Okay, thank you for that. Next, I'm going to check cranial nerve 7, excuse me. And I need you to, everything looks symmetrical, by the way, first. Can you raise your eyebrows for me? Can you raise your, can you smile for me? Can you frown for me? All right, can you puff your cheeks out for me? All right, thank you for that, I appreciate it. Next, we are going to move on to the ears. And first, I'm going to do an inspection of symmetry to both ears. And they both look symmetrical. Try to rule out microtia, which is enlarged ears or protruding ears, which could be an element to hearing. Next, we're going to do, I'm going to palpate the mastoid process here. And I am observing for any redness, any lesions or anything here. And I'm checking for tenderness. Is it tender at all?
Mm-hmm.
Any pain? I'm checking the right side. Any tenderness at all?
No.
And if there was some tenderness to that area, that, you know, that could be a sign of an untreated otitis media that it just is recurring and it's never been treated properly. Next, I'm gonna palpate the outer ear with the penne and targus. And again, I'm looking for tenderness or infection or anything like that, any lesions. Any pain to that area?
No.
Tatiana. Moving over to her right ear. Any pain to that area?
No.
All right, thank you for that. Next, we're gonna move on to assessing your hearing. First, I'm gonna do the whisper test. I'm gonna hold one part of the ear and I'm gonna whisper to your left ear. And you'll let me know if you're able to hear or not.
99.
Thank you, Greg. All right, I'm gonna check your right ear.
29.
Yep, she did get those correct. You passed the whisper test. Next, we're gonna do we're gonna check we're gonna do the Weber test, and then we're gonna do the Ryan test. And I'm gonna simulate that this is a tuning fork. And I'm gonna hit it right here. Boom. Can you hear on both of your ears with that?
Correct.
Thank you for that. And then for the Ryan test, I'm gonna do that to her mastoid process. Are you able to hear?
Yes.
Do you hear that? I'm gonna do her right mastoid process. Are you able to hear that?
Yes.
And there, we're checking for air conduction, air and bone conduction. And the norm is that air conduction will be greater than bone conduction. And if there was a problem, and if you did hear the bone conduction louder or longer, then there would probably more than likely be a problem with your ear. All right, moving on, I'm gonna assess your external ear canal. Is that okay?
Yes.
Thank you, Tatiana. And what I'm looking for here is any swelling or redness or any discharge to this external area canal. And everything looks good. I'm gonna check your right. And I forgot to mention, I'm also looking for any foreign bodies to this area. And everything looks good. Next, I'm gonna assess her tympanic membrane. And I do see pearly gray, translucent pearly gray, and there's a reflective cone at 7 o'clock. Excellent. Moving over to your right. Assessing that tympanic membrane, and I do is a translucent pearly gray, and that reflective light is at 5 o'clock. Thank you for that. Next, we're gonna move on to your eyes.
Okay.
Is that okay?
Yeah.
All right. First, I'm gonna check your eyebrows, your eyelashes, eyebrows, and palpebral fissures. And I'm looking for symmetry, which I do see. I'm trying to rule out any alopecia or signs of abnormalities or congenital abnormalities, and everything looks good. Thank you for that. Next, we're going to do some visual exams.
Okay.
first we're gonna use the visual, gross visual acuity, and then we're gonna do the visual fields by confrontation. Alright. And I'm gonna ask you to hold this up to your right eye. And can you tell me, I'm supposed to be at 6 feet, but can you tell me what this is? Number?
2.
2. Thank you very much. Can you cover your left eye? Can you tell me the number?
2.
Thank you very much. Next, we're gonna check, we're gonna do the visual field by confrontation test. Excuse me. What I want you to do is do it exactly, just cover your right eye, and I'm gonna cover mine, and I'm gonna cover my left eye, and I'm gonna hold my hand, and I'm gonna count, have numbers listed. You tell me when you're able to see them, okay?
Okay. 1.
You see it already?
Yes.
Thank you. All right, can you cover your left eye? And I want you to look at my left. Can you cover your left eye? I want your right eye to look at my left eye. And can you tell me what I'm holding up?
2.
Wow, that's pretty good. All right, well, you passed that test. Next, we're gonna do, the papillary reflex, or papillary response to light, which is, it's gotta be consensual. Well, it's direct consensual papillary response to light. That's the next exam. And I want you to look at me. This is what we're gonna do. And I'm gonna flash this light, and I am checking for your pupils to see if they're responding. I do have constriction. And I have, her both pupils constricted. Her left pupil constricted directly to direct light, and then when I shined it from the side part, the side portion of her left eye, both pupils did constrict. I'm gonna do the same test on her right eye. Let's cover this. Pupil constricted. Now we're gonna open that, we'll drop that, and then, again, her right pupil did constrict, and then when I had the light at an angle to her right pupil and took the card off her left pupil, both of them did constrict. So you passed that test. Excellent. Next, we're going to do accommodation and accommodation. And I'm going to use this. I want you to look straight ahead. Pick a point right there on the wall. And I'm going to bring this over. I think I should shine this light. Alright, and I'm going to use this. Yeah, and I did see her pupils accommodate to the light and in a way. Next, we're going to do, what's the next test? We're going to do accommodation. We're going to do the gaze and the gaze test. Gaze and yeah. Oh, excuse me. We're going to do the gaze and extraocular movement test. All right. Next, we're going to do. Let me see what we're going to do. All right. I'm going to stand real close to you. And then I'm gonna follow I want you to follow my hand. And I want you to follow, let me just use this. Follow this, okay? I'm gonna go up here. And your eyes did follow the instrument in an H pattern. All right, so I'm complete. That's a completion of the eye exam. We're going to move over onto the nose assessment portion of the assessment. First, I'm going to do an inspection of your nose, and I'm looking for symmetry, and I'm looking if it's straight. And it does look straight and symmetrical. Next, I'm going to check your nostrils. Thank you for that. And what I'm looking for is any polyps, and I'm checking for any septum deviation, any drainage. And everything looks good. Thank you very much. Next, I want to check for patency. Can you cover one of your nostrils for me? Can you sniff? All right, excellent. Can you do it? Excellent. And then finally, we're going to check, I think that might be it. Patency. Yeah. Oh, I got to check the mastoid and sinus process areas, okay? So I'm just going to palpate this. Is that painful at all?
No.
And then I'm going to palpate your sinus portions of it. Any pain at all?
No.
All right, excellent. All right, next we're going to move on to mouth and throat. And I'm just going to check. I'm going to do a visual of her lips and assess your mouth. Now, can you open your mouth now? Thank you. And here we're checking the tonsils and the tongue. Can you say ah?
Ah.
There, I'm checking the soft palate, and it did rise equally. And also the uvula did rise in its midline. Can you raise your tongue, please? Thank you. I'm checking for periodontal disease. I'm checking for any lesions. Can you open? Thank you. And that looks good. Thank you very much. Any pain when you did that? And next we're going to check, I'm going to check your TMJ. That's what I'm going to check for. And I'm going to palpate right here. And I need you to open your mouth and close it. Is that painful at all?
No.
And I did not feel any crepitus when I did that. So. And then, let's see. Next, I'm going to check your neck. And I'm going to do a visual inspection of her skin on her neck. And again, I'm looking for color, temperature, any moisture. We're looking for the texture to see if it's smooth, any edema or any swelling to the area. We're looking at any lesions, any scarring, or any nodules. And her neck looks good, the skin to her neck looks good. Next, I'm gonna inspect her inspect your trachea. And the trachea does look midline. Any pain to that area?
No.
No symptoms of enlargement and no symptoms of any goiters. Next, I'm going to palpate the thyroid gland. I'm going to check the thyroid gland. Can you swallow? Can you swallow? All right. That did feel within normal limits of the thyroid gland. Let's see. Next, I'm going to check your carotid arteries. And one at a time, of course. And I'm palpating the left carotid. Any pain to the area?
No.
check your right one. You have a strong pulse on the left and strong pulse on the right. Next, I'm going to assess for any bruise too. Is that okay?
Yes.
Right. Alright. Gonna need you to hold your breath real quick. Hold your breath. Thank you. You can breathe now. Alright. I'm gonna check your right carotid artery. Hold your breath. We did auscultate within normal limits. What we're assessing for is any symptoms of atherosclerosis, any narrowing, and you would hear that with the bruit. So next, finally, or I think I got a couple more. We're gonna check for range of motion to your neck.
Okay.
So can you turn to the left? Can you turn to the right? Can you bend over your neck? Can you bend up? Okay, that looks good. And then finally, we're gonna do check your shoulders. And I need you to raise your shoulders up. Excellent. So, and that concludes our assessment, Mar. Do you have any questions for me?
No.
All right, well, Tatiana, thank you very much.
Thank
I
you.
appreciate it.